Hi, I'm Dr. Kevin Sadati, practicing in Newport Beach, California. I'm board certified in facial plastic surgery as well as cosmetic and reconstructive surgery. With over 10 years surgical experience, I've performed thousands of cosmetic and reconstructive procedures throughout my career. I would like to explain what a breast augmentation, also known as breast enlargement, is. There are two main ways of enlarging breast tissue. One is using implants and the other one is using your own fatty tissue. There are two types of implants. One is saline and the other one is silicone. A saline implant is filled with saline during the surgery to adjust to the patient's desired volume and are less expensive than silicone implants. A silicone implant is filled with silicone gel. The size of the implant is predetermined by the manufacturer. Silicone implants are very soft, natural, but they are more expensive than saline implants. Not everyone is a good candidate for silicone implants due to certain criteria set by FDA. Implants are placed either under or over the muscle or in a dual plane. There are several factors to consider to where the implant should go. For example, if you would either put it under the muscle, it's called submuscular, or putting it on top of the muscle is called subglandular. I would recommend under the muscle if you're planning on breastfeeding, and if you're a swimmer or bodybuilder, I would advise you to have the implant placed on the top of the muscle. Whether or not you would be a good candidate for saline or silicone, or whether it would be better to have placement of the implants over or under the muscle, we would determine what would be the best and most natural augmentation for you during the initial examination. There are three methods of insertion of implants. The first is by making a small incision under the breast crease and making it well hidden. The second approach would be an incision around the nipple area and leave no signs of surgery. And the third is making an incision under the armpit, also known as axilla. Depending on the shape of your breast, I will advise you which approach is best for you. Once you decided to have breast augmentation using implant, the surgery is performed on an outpatient base and it takes about an hour. After surgery, you're required to wear a sport bra for 1 month for support. Your implants will initially be in a higher position on your chest, but will descend once the swelling subsides, and this can take up to 2 months with massaging. Another option for breast augmentation or enhancement is by fat grafting method. Fat grafting is the most natural way to enlarge breast tissue. The way it is done is by harvesting or taking your own fat tissue by liposuction from your abdomen, love handles, or your thigh. Then I will mix your fat with your platelets and inject the mixture into the breast tissue. Adding the platelet helps the fat cells to survive after the injection. The only limitation to this method is that you cannot go from small b to a full D cup size in one approach. To get to this desired size, it may take up to 2 procedures, and the wait time in between each procedure is about 6 months to a year. And you would be a good candidate for this procedure if you have enough fatty tissue to harvest. If you don't have enough fatty tissue, that would not be a good option. If you would like to know what procedure is best for you, I will need to see you in person. Please, for a complimentary consultation, call our office, or you can visit our website, galleryofcosmeticsurgery.com, to see some of my before and after photos. I'm looking forward to meeting you soon. Thank you.